pledge allegiance to the flag of the United States of America, for which stands one nation, yeah, and justice for all.
Motion to approve?
Second.
Second, is there, may I record the minutes as approved by acclamation? Excellent. So minutes are reviewed and approved. And with that, the housekeeping aspect of the meeting can begin. And I would like to start by welcoming our two newest members. And I can't tell you how thrilled I am that new people taking an interest and volunteering their time and bringing new blood, new energy, and new insights and opinions. So I'd like to ask them both, only one here in person and one on the phone, but I'd like to start in the order of how I became aware of them joining our organization, and ask Bob to take a couple of minutes to introduce himself to our board.
Okay, thank you. My name is Bob DeSidju, and I'm the new to Radnor Township. I lived in Lower Merion for about 30 years. We just recently moved in August to Radnor, and I was intrigued by how friendly everyone is at Radnor Township. So I investigated, and I sought out to be a member of this board, and thank you for having me be part of it. So I'm an oral and maxillofacial surgeon by trade. I work at Thomas Jefferson University Hospital. I can bring to the board my experiences in dentistry, in medicine, and public health. So I have a degree in dentistry from the University of Pennsylvania. I went to medical school at Jefferson Medical College, now the Sidney Kimmel Medical College, and I have a PhD in population health sciences. So I think I can bring some valued information to the board and hope and help the township. Thank you.
Thank you. Thanks for your interest, and welcome aboard. We're thrilled to have you. And on the phone, we have Dr. Julie Kohler, who I am meeting by telephonically for the first time. And Julie, can you introduce yourself to the board for us, please?
Yes, hi, it's nice to meet you. I'm sorry I'm not there in person. If I had known there was no video, I would have done my best to come in. It's nice to meet you. I moved to Radnor 2 years ago. I have two children. They're 9 and 11. They go to Eisen right now, and we moved here from the school districts for the school district. We came from the Jenkintown area, and we're really, really happy. I wanted to get involved in the community in some way and give back. A friend of mine who's a neighbor, she said I should get involved with this Board of Health. I'm a clinical psychologist. I have a private practice, a full-time private practice. Right now, it's mostly remote, and I also see some patients in my home. I used to have offices in Bryn Mawr and Philadelphia before the pandemic. I got my undergrad degree at Stanford and then my doctoral degree at Drexel. I did pre-doc and postdoctoral residency at Penn. And I see patients from teenagers all the way up to their 90s. So I wanted to join the board, and I love problem solving. I specialize in forensic clinical psychology, which is really just the cross-section of law and psychology, and I did a lot of research on how do you apply that information, data that you obtain through different protocols to public policy, and then also to the courts. So I like thinking through problems, and yeah, I'm happy and thrilled to be here. So thank you.
So thank you both, and Julie, you raised a couple of issues that I think are worth addressing, because we are pretty much that, a problem-solving organization, in that we exist to bring our collective expertise and reach consensus on issues that we believe that the Board of Commissioners might need our insight into, and help the township in solving problems. So we're thrilled to have you both. I'm astounded at the breadth and depth of the expertise that we can bring to the table now, and we still actually have one remaining open position. So our recruiting isn't done until we're completely full. You also raised another question that I want to take up as part of our meeting planning, and that is I am thrilled that we're finally meeting in person. I think we have a highly vaccinated and responsible organization that will allow us, despite the fact that we're not quite done with the epidemic phase of the pandemic, we're entering the endemicization phase, if that is a word. But I think that to the degree that I sent around that email, that we encourage vaccination and encourage mitigation in circumstances of unknown or elevated risk, I think that we can help to get through the rest of it. So I think that as long as things stay the way they are, we should try to continue to meet in person. But I think having the Zoom accommodation is a great way, because we're all volunteers. Everybody has their own lives. People like Kathy, who is a real trooper and is out of town and is still doing our minutes for us despite being out of town, is able to do such because of the Zoom. And so for the moment, I think we'll try and keep Zoom available as an option for those who might not feel comfortable coming in, for those who can't make it, and to expand our reach to the greatest degree possible. And with that, I actually would like to bring up the fact that our next meeting, so our meeting this month is about as early in the month as the third Monday of the month can be. Our meeting next month is actually about as late in the month as the third Monday of the month can be. It's December 21st. And I just wanted to poll the board for the purposes of, if we make it available as both an in-person and Zoom meeting, do we have enough people that will be able to make themselves available on that evening, that we don't need to figure something else out, being that is holiday week, that people have travel plans. But I just wanted to anticipate in advance whether we would be able to put together a quorum and meet on our timely and stated meeting next month. So let me just get a quick show of hands. Is there anybody here who can say that they are not able to meet either by person or by Zoom for a 5:30 Tuesday, December 21st meeting?
I'm good, David.
Well, so. Say
I'm
again?
good.
That's why it's on Tuesday and not our usual Monday?
I don't know. This
It's
is the third out of 4 meetings this year that it's a Tuesday, not a Monday, and usually it is either a building is closed or the for whatever reason, the Board of Commissioners has a scheduled meeting on the Monday. And well, since we're service organization to the Board of Commissioners, they get first charge. I think two of the 3 times this year that we couldn't meet on Monday was Board of Commission, and one was a holiday. So I agree, it's been a little bit tough, because I just make the assumption it's the third Monday of the month and don't necessarily go to the schedule, but that would trip you up a couple times this year. But so hearing that there are not a lot of people that won't be able to make it, I think we just leave our next stated meeting at Tuesday, December 21st at 5:30, and we'll include the Zoom if there are people that will be out of town and would prefer to join by Zoom. Any other comment there, or are we good to go on?
David, did you check on the Board of Commissioners meeting? Is it Monday, the 20th?
I did not check, but I believe it is.
All right.
I don't think that's our scheduled meeting, but I can't say if there's a different reason for the change to Tuesday.
So if there were a strong preference for Monday over Tuesday, and we could make it Monday because there is no impediment to it being Monday, I will look into, make that an action item for me, if you would, Kathy, to look into
Got it.
why we're on
Got it.
Tuesday
Yep.
instead of Monday, and if we can make the switch to Monday.
Okay,
All right?
you got it.
And since we kind of touched on the COVID and flu issues, we might as well, I'll take the chairman's prerogative and move that up now. I just want to finish my comments. We in Delaware County and in Radnor Township in particular have been very, very lucky never to have had a really hot period during this. I think that in no small part is a testimony to the fact that people have been smart and dedicated and done the things they need to do to avoid, and that we are a highly vaccinated township within a highly vaccinated county. I am not at all certain that there will not be another wave, but it seems to, in fact, there are other waves. It seems to be waves of predominantly infections of the unvaccinated or those for whom immunity is waning as a consequence of the timing of their original vaccination. I'm happy to report that it appears that in the places in Europe where there are large outbreaks of breakthrough infections, the infections do not appear to be severe and are rarely associated with hospitalization and more rarely associated with death, and that breakthroughs in treatments make the experts believe that we're in the what I call the endemicization period of the epidemic, and that hopefully, if we can make it through this winter, we may get to a different but more normal by next spring. But let's not forget that we have a highly naive population right now with regard to influenza, because last year there was almost none. The year before even less, and that has two issues associated with it. One is that all viruses love a naive population, and two is that the data used to select the appropriate strains for the vaccine is a more limited database, and we don't know what vaccination status, what the status of that vaccine might be. So that being said, mitigation, I intend to continue wearing masks in public because it's a flu prevention as well as a COVID prevention. And for me, it also keeps my hands off my face. And now that we're back to flu concerns, whereas with COVID, the hand washing may not have been quite as important, with flu it is extremely important. So encouraging folks to get vaccinated and encouraging appropriate precautions in the coming months, I think, is something that we can all do for the health of our township and our families. Any other comments?
Is there any plan to educate the citizens of Radnor Township on the flu vaccine and the COVID vaccine, the boosters, and for those who are not vaccinated?
It's the right question, and I don't have the right answer. I don't have any answer. There are no plans. Any ideas that you might have, of course, would be welcome. So, and if I can...
I mean, David, I think the issue was that all last year we were relying on Chester County to push at all the education because we were going through their health department. Now Delaware County has their own, so I guess, is Delaware County going to act as that liaison to the township like Chester did last year?
So Kathy, you absolutely read my mind, because I was
Oh,
going to say,
good.
I was going to say that we might table that conversation to the Delaware County conversation, but I think that we should perhaps bring up the Delaware County conversation now, because I think a lot of what we talk about today may be shaded by what's going on at the county level. And I think I'd like to take a moment to update our new members on how this kind of emerged. So we live in a country that does not have a national public health system. And when the pandemic hit as a major event, of course, it exposes all the flaws and weaknesses in the system that you might have and the way public health is administered. And Bob, I don't want to step on your toes here. You have more expertise than I do on public health. But the way public health appears to be administered in this country is anything that comes from the federal level is administered through the states. And in the state of Pennsylvania, health issues are administered at the county level. So that any federal funds at the beginning of the pandemic that came to the state for programs related to COVID were administered from the state to the county level. Well, there was an historic issue with that for Delaware County, because historically there was resistance on the part of the government of Delaware County to have a county board of health or a county health commission and a county health commissioner. And just as Kathy just said, when the pandemic hit, we did not have such. And so our neighbors in Delaware County, rather Chester County, were kind enough to utilize their resources to help us to administer COVID-based programs, because that was the only way to get those programs administered if they came from the state or federal level. I think it's now, boy, I think it's about 2 years ago that the county decided to establish a Department of Health, what are they calling it? They're not calling it a Board of Health, are they? They're calling it a health department with a health commissioner with a health department. And it is in the process of being built out. And of course, there are lots and lots of aspects of that which are not yet fully determined or fully worked out. And so when we come back to the health officer's report, for example, Alex had identified an issue there. So the inspections of health inspections of township facilities, that's something that will transition over. And there are an array of functions, and we have to figure out where they will live. In fact, the first presentation we had from the people planning the Department of Health, there was a somewhat casual remark made by one of the individuals that there would no longer be township boards of health. I don't believe that that will be the case. We are an all-volunteer organization. We do not have a budget, and we are not encoded with power at the level of state or county regulation, but we exist at the pleasure of the Board of Commissioners to act in an advisory role for the Township Board of Commissioners. So there's no reason that we shouldn't or couldn't exist, although our roles may evolve, emerge, and change. And we're working on doing just that. That is to say, working with the Board of Commissioners, the township professionals, and the county department as it emerges. And this was supposed to have been a quick follow-up on my part, but because the former, the last health officer of the township, Marie Carbonara, was a regular at these meetings and a stalwart for us at these meetings. And I guess it's 5 or 6 weeks ago, she resigned her position here as the health officer in the township in order to take a job with the newly emerging Department of Health. And so I thought that that would be an excellent connection for us, and have kept in touch with Marie. The plan had been to have them come to our meeting to give us an update. They did twice last year, I believe. And in my communication with Marie, she suggested that we postpone for one more meeting because things were crazy. She didn't have everything together quite yet, and she thought that there would be a lot more meaningful updates for us at the next meeting. So that's where we stand. Maura, any additional comment on that?
Just that I think that our township manager shared with this board and the Board of Commissioners, there has been a letter, I'm just looking at it now. There was a letter sent to municipalities from Dr. Monica Taylor, a county council person, about just sort of the update that they're in the hiring mode. They hired the environmental director. They announced Marie Carbonara's appointment. And the county wellness line has been launched. And they have approved the inaugural Delaware County Health Code and a fee schedule. So there's been, some significant movement towards the establishment of the Department of Health. And as far as our township, you stated that inspections will no longer be managed by the township. I've been assured by our community development director that in this the stopgap period, we do have the manpower to address inspections and the like until the county takes it over. Even though Marie's not here, we do have staff who are continuing to do it. So inspections are being done because it hasn't been fully handed over to the county as the time of my conversation.
Yeah, just briefly. So from Kevin earlier, the process for inspections right now is that we have a third-party inspection firm that is conducting food safety inspections. They have a certified health officer that is on staff. So inspections are ongoing. Even though we don't have an on-staff health officer, we have a third party that has an on-staff health officer. So inspections are ongoing.
This is an intersection of earlier conversations for me because when Chester County was managing our COVID response, they had a blackboard, well, not a blackboard, a dashboard on their website for following the pandemic that was really quite effective and took the data down to the county level and separated out dormitory people from people in the general public. I think it's about 2 or 3 months ago, we stopped being served by that Chester County system, and now the only place that I can find government data on is a state level. It does not drill down to the township level, and I find it to be difficult to read and understand. So I feel a little bit in the blind with regard to our data, but you just have to piece it together now, and that's the kind of thing that in a transition, sometimes you just don't make the smooth transition. So I'm hoping that our county Department of Health will pick up where we were before that separation, and it will be able to get good data on local health issues like COVID and for example, flu. There was a pretty significant flu outbreak in Glassboro, I think, New Jersey, that happened at the end of last week. If it happened there, the flu outbreaks are coming. Any other comments?
So David, we should be expecting an update in December meeting. Is that what you said?
Yes.
Okay, perfect.
Okay. And Marie will be our contact point for that update.
Okay.
And that actually raises the last issue that I would raise on the meeting planning, which is that I want to thank everybody because I've been trying to make these meetings more executive in nature, meaning we try to start on time, we try to finish on time, we try not to leave open issues that are not addressed. If they're open, we keep them open. If they're closed, we close them out, and making sure that people are accountable for the things they do, and everybody has been unbelievably cooperative in terms of accountability for the items, and and getting us into a more organized and tightly run meeting. So I want to thank everybody for that. If there are no comments, I have been charged by Kevin with the thrill of being the third-party reporter of the health officer report, with Kevin responsible for forming up the report, and he shared it with me, and he sends his apologies, but he had a conflict and could not resolve the conflict, and so he sent the health report for October, and I'm pretty much I'm pretty much just reading from his report. Food safety inspections we've already covered off on. It's a third-party consultant with a certified health officer is bridging the gap until that function turns over to the county, remembering that as with all things, budget and power are important issues, and who's paying and who's doing it will drive a lot of what is done. And we'll have to see whether we have a role in the township, depending on what will be done by the county. They inspected a temporary event for St. Catherine's at Beauconnor Park on October 9th. Responded to one new wound of unknown origin. A pet involved was previously vaccinated for rabies and received a booster shot as a result of the incident, and is following the owner is following a 90-day observation period as required by municipal regulations, and that will touch on one of our follow-up items when we get back into order on the agenda. They continue to follow. The staff continues to follow up on a previous dog incident from September. No visible wounds. Waiting on veterinary documentation. The owner reports that the dog is healthy and doing fine. And the staff continue to work with the state, cross-posting health alerts on the township website. And that was something that Marie always did for us. Any of the health alert notices that came to the state, from the state to the local level, Marie sent them out, and Kevin is promising that the staff will continue to do that. And finally, the Red Cross hosted a blood drive in the Radnor room on October 27th, and they will continue to coordinate such, to cooperate with Red Cross and coordinate such activities in the future moving forward. And that was the last item on the health officer's report. Any comments or questions? So getting back to the agenda as published, we've come to old business. And the first item up on the old business was a follow-up from Joan and Maura on animal health ordinances restructure that they have undertaken. And I'll turn it over to the two of you to update us on that.
Joan, you mind if I jump in? Okay, I had a conversation with the township solicitor just this morning. We've been trying to connect on this, so small steps forward. He has reviewed the document that Joan put together very nicely, going through the code and really identifying places that need to be fixed, updated, or considered for amendment, and suggests that we that the Board of Health should prepare a proposal to the Board of Commissioners that would then be asking staff and the solicitor to kind of go forward and do the work. So I think we're mostly there with what Joan has done, but perhaps she and I can work in this next couple of weeks to refine it into a real proposal to bring to this body, and then ask you to sort of bounce it back to the commissioners. So it's and then the commissioners seek, that's where the commissioners would then recommend, or not, but hopefully recommend that the staff and solicitor resources are to put together a real ordinance proposal that we can vote on. So it's a couple-step process, but with Joan's good work, I think we're pretty close to it. So maybe we could do it by email in between meetings so that it's not a whole month delay.
if I can paraphrase, then the two of you are working on editing and condensing down the broad and deep array of observations that Joan made at the beginning of this into a single document, which would be a new health ordinance that we will then bring to the Board of Health to make sure that we can sign off on that as a Board of Health. And then I will forward it just as the chairman of the Board of Health to the Board of Commissioners, and they can act on that as they see fit, knowing that some of the things might require ordinance and some of them might require budget, but it will be then up to the Board of Commissioners to either send it back to us for further modification or to carry it forward. Is that summarized?
Yeah, that sounds about right. And it's my understanding that there were some changes to the ordinance, but it hasn't been since about 2013. And John Rice had reviewed what Joan had done and agreed that there's some work that can be done to tighten up the ordinance. And then there's some, I think as we've talked, there are sort of buckets of the piece of the proposal. Some is just easy fixes. The language is strange. It doesn't really communicate the intent of the ordinance, and then others that might need some, as you said, budget considerations and might be a broader approach to improvement. I know that there's the issue. We chatted quite a bit about signage for crossing areas for deer and other wildlife. That really wouldn't require an ordinance. That would require, staff to make those determinations if that's something that they've identified a need for. So that's conversations that I could have with staff around where do they have to go pick up carcasses and where do they often see these crossings, and talk about putting up better signage and that sort of thing. So some things don't have to be legislative, but they just have to be pointed out that it's an important action for the township to take. So I think that's what the proposal should look like, is some legislative changes to the ordinance, some signage or discussion about wildlife in the township, and let's sort of get that kind of wrapped up with a bow to send it back to the Board of Commissioners.
So, sort of to follow up more about the signage, it would be best included with the rest of the animal ordinance as far as a proposal?
I think it would be best to include in a proposal to say these are actions we'd like to have taken.
Okay.
Not all of them will require action by a vote of the board. Some is just, the Board of Health has identified an issue, and,
Okay.
It's sort of more handled by staff and resources and that sort of thing, but it's not an issue that the board would have to vote on. So those items might actually be moved more quickly if approved, or if the resources are there. And, that can be some rounds of discussion among maybe Joan and I with the township staff to kind of identify some areas.
So I did get a chance to talk to Officer Steinson, who heads the traffic safety, and he said that while it doesn't require an ordinance, he said it does require Board of Commissioner approval. So I
guess,
I was a
if
little
there's a
confused about
significant
that.
expenditure, it would require board approval,
Mhm.
but the manager has, the manager has discretion up to a certain amount. So I guess it really would depend on what kind of budget would be required for signage.
He also said that it's the type of thing that would probably just get rubber stamped. And he said that as far as signage, because we did talk about the difference between deer crossing signage and general wildlife signage, which does exist and might actually be a better idea, or maybe a combination, but there's something called the Manual of Traffic Control Devices that lists the different signs that are approved and that we could use in Pennsylvania. He also said that the worst part for deer hits is the lower end of the township, particularly around Bryn Mawr Avenue. So we would have to really identify the spots. The issues, one of the issues that he stated was that in some cases, the high-traffic areas signage would need to be on private property, and that would not require, but we would seek the approval of the homeowner. But it's not, certainly not required. But he also said the other issue being state roads. And the state roads in Radnor Township are King of Prussia Road, Lancaster Avenue, 320, Conestoga, North and South Wayne Avenues, Darby Paoli, and Bryn Mawr Avenue. So a significant amount is state roads. He did say that the way it could be done on state roads is they would put it through to the to PennDOT, proposal in writing to PennDOT, and that generally does take a while. He also said that we should attend staff traffic and safety meeting to have it put on the agenda first. So I guess it would have to take that route first before it could go to the Board of Commissioners for a rubber stamp approval, essentially, as you said. And the next one is December 15th, that next meeting at 10 a.m. It's a Wednesday. I think that's it.
Perfect, thank you. I realize that I kind of failed on my duties in that I didn't, when we asked Bob and Julie to introduce themselves, I didn't make time for us to introduce ourselves, but I'd like to point out to our newcomers that Joan is a practicing veterinarian who has regularly demonstrated an extreme passion for the safety and well-being of our non-human domestic and non-domestic animal life, and has taken on a couple of projects in which she has invested significant energy, and I want to thank you for that. And it sounds to me like you have not only made progress on the animal ordinances, but also on executing against your vision on the traffic safety piece with regard to animal health and well-being. And if I could just take a second to loop that into the road safety in Radnor Township, I acted a little too late in the month to be able to get Chief Flanagan on our schedule to kind of lay out a roadmap for what really is and is not, and what we might or might not be able to do about that. He was unable to come tonight, but I'll work at it earlier in this cycle to get Chief Flanagan for just the general road safety issue. And I'll point out that the city of Philadelphia has a funded, pretty substantial program called Vision Zero that came across my desk, and I would recommend that folks might want to go to, it's visionzerophl.com is their website, and their vision is for 0 traffic fatalities on the streets of Philadelphia, and they have put together an organization and a plan to try and do that. Now, of course, City of Philadelphia has a completely different set of issues, problems, and needs from Radnor Township, but it is not our imagination. The City of Philadelphia, so far this year, is 20% up in terms of traffic fatalities over, I don't know whether the comparison was just last year. I think it's a 5-year running average. Coming into this year, we're 20% up. So it is not our imagination that there's something going on the roads out there, and I think that should be a prompt for us to continue that, so that we should probably keep that issue in our old business running follow-ups. And so with that, the next item is which was the second item, is the school board relationships. And I'll turn it over to Maura and Alex for an update there.
My update to the school board relationships is that at the moment there is kind of no update. As we kind of talked about at the last election, or at the last meeting, there was an election coming up. A couple of updates from school board itself. I do want to let everyone know that they are doing vaccine clinics now for 5 to 11-year-olds. They are also starting a booster shot clinic for staff. And I have also heard from Superintendent Dr. Batchelor, who has been very responsive, and he said that it seems like they will be ready to report on staff vaccination rates at their next meeting. They just had to collect data for that. And since it does tie in a little bit to our welcoming of new members, I do also want to thank Amy Goldman, who's on the school board, for bringing us one new member, and Lisa Browski for bringing us our other new member.
So for the new members, as a board, we have kind of tumbled to the conclusion that although we act in a consultative role to the Board of Commissioners, in this township, the school board is a separate entity, and a significant chunk of the health issues in the township might arise or be conducted at the level of the school board, and that it would benefit all parties involved if we were just to have an active relationship. So perhaps somebody from the school board could join us at their meetings, at our meetings, and if it worked out that way, we might send somebody to the school board meetings. So we covered.
David, I would like to add that I have been in communication with the president of the school board, and she's, we've had a couple of conversations about this, and is taking it forward, at least to their executive committee, to kind of get a sense of the school board's idea about whether they would like to have somebody assigned to this board and what type of person that would be. Would it be a school board member or a staff person from the school district? That's what they were going to discuss. I believe they have a meeting tomorrow that might start that conversation.
Perfect. Thank you, Maura. That's great. So progress there as well. So the last item on the old business was, I just put it there because it's an item that unless there is somebody here who wants to suggest otherwise, the issue raised at the public participation relating to the parents of children who were concerned about mold mitigation on the Villanova University campus, there has been no further, to summarize, we do not have a mold mitigation program at the township level, at the county level, or at the state level, and we don't have any means to take action. So we demurred when it came to a request for us to intervene in some way with what seemed to me to be predominantly a discussion between a group of parents who had identified mold issues at the university and the university. And I from what I last heard, my best news is 2 weeks ago that they're moving to resolve those differences. So if nobody has a reason to keep that on the agenda, I am going to close that out as an issue.
I think if you do want an update, there is just that the university had inspectors come in. They did a visual inspections. They found what they were finding is there was no systemic issues. They did find mold. They would remediate when they found it. They respond to all reports, but proactively they weren't able to identify, say, a building that was affected because of construction or leaks or something like that. There was so they're doing some education with students around keeping damp clothes. One thing was identified that during the summertime, air conditioners were running, but with the windows open, so it was causing some sort of humidity issues, and that they are working on some drainage issues that they think will. They weren't finding water entering, but they're trying to remediate. So I believe that the university was very attentive. They've been in communication with parents and students, and I think they took it very seriously, and they worked really well with making sure that the township was informed at every step of the way what they were doing. So it may have been, a bad situation in certain places for the rooms, but once they were made aware of it, I think they did what they could to try to remediate the issues.
Excellent, thank you. Any other comments on that topic?
No, David, I would just
To,
close it out.
Keep it as an open item?
We could. My preference would be to close it, and if the issue raises again, bring it back up so that we don't just have it as a rubber stamp to move through. If there is news, we can bring it back up.
Yeah, I don't think there's much action that this board or even the township staff is able to take. And it does seem that the university is doing what they can. So I would recommend closing it unless we hear that it continues to be an issue or unaddressed.
All right. So with that, we come to one of our most important ongoing items of business, and that is our student interns project. And I'll turn it over to Lisa, Alex, Anna, and Hayun.
So over the past month, the students have been thinking about what their interests are and what kind of project they would like to undertake. They've come up with a topic, and then our plan is over the next month for them to come up with a proposal of sorts, or their hypothesis, kind of some background information about their project and the way that they're planning to do their project and report to the board next month. So what they're planning is to look into, with especially with virtual school and Zoom, there's been a lot more use of headphones in the schools and at home. Headphones are actually distributed at times at the school to students, and then students can also use their own headphones for different activities. And kind of looking at, if long-term use of headphones, looking at data regarding any adverse health effects. We may focus, it seems like the use of headphones is at each level, but since they're high school students, may focus more kind of at the high school level. So we were discussing before the meeting different ways of kind of gathering that data without a student survey and
Yeah.
and being able to report some info back to the board. So we'll have a little bit more information next month.
Comments? Oh, I think that's actually it's a pretty interesting and clever idea, and I like it. And I would just make the recommendation that you look at that from both sides. That is to say, not just from the point of view that there may be discernible difficulties, but what are the advantages against the problems, and if the problems seem substantial, what are the mitigating opportunities? But that's a great idea. Thanks. Any other comments? Excellent. So that brings us to the new business. I don't have any new business to bring up myself. I generally like to leave that on the agenda, because if there is anybody on the board who has a topic that they want to bring up and get in the queue, I think now would be a good time. So if there are any issues or projects or concerns that somebody wants to raise and put into the agenda of the board, now would be the time.
I just wanted to, 'cause I know we went a little bit out of order at the beginning, but I wanted to kind of reiterate something you touched on earlier, which is our role now that there's a county board up and running, that I do still think we have a role, and I know that some of us have heard from community members that they are either confused about what our role will be or are concerned about what our role will be moving forward. But our mission, as listed on the township website, does give us significant latitude to, do different kinds of programming. And we also just are at a time where we have, I don't think there are any two people on this board right now that have the same specialty. We have Joan, who, as you pointed out, has been doing great work on the animal ordinance. We have Robert, who just joined tonight, who brought up a great point about, possibly doing some vaccine education programming. That is not something that the county board is going to have ready to roll out right after they got set up. we have Julie who just joined, who is, a mental health professional, and we know that that is an area that's often lacking when it comes to, public health being taken care of. So I certainly think that we still have a role going forward, and I think we should actually all be pretty excited to see what we're able to do moving forward now that we have the county, taking some of that on themselves.
I couldn't agree more. And I think again, we are volunteers. We do not have a budget, but if we see an area of concern that we can articulate to people that do have budgets in such a way that we can generate support for that, we can always go and find money for projects that are deserving. And I would suggest that the work that Joan and Maura are doing on animal health ordinances as an example of something that came out of this board. I think that we are just in the nascence of forming up efforts to help the township and the police department to see and improve what we perceive as the health issues around road safety for humans and animals. I think that we have a great broader concern for the value of the natural environment in which we live that underlies the superstructure that we put on for our human domestic life, and to protect the quality of our animal life here. There's a shade tree commission for the trees. There's not necessarily an animal commission for the animals, and so I think that we sometimes move slowly, but we have the energy and the passion because we are a volunteer organization. And I think other things include providing the Board of Commissioners with support on the notion that we felt that it was not an appropriate thing for a township to take up regulation around mold monitoring and mitigation if at the federal, state, and county level well-resourced health commissions had declined to do that in the past. And at the end of last year, when there was a threat that there might be broad spraying for lanternfly, we also developed a rationale for the township to go back to the agricultural department and suggest that unless there was a specific documentable hotspot, broad and potentially toxic spraying of insecticides for a problem that didn't exist in this township was not a great idea. So, I mean, that's just a brief review of the work that we've done. And it may sometimes feel like we move quite slowly and sometimes feel like we're hardly getting anything done. But when you add it all up, I think that we continue to have a role, and thank you for the support there, Alan. Okay. Anything else on the new business?
I'd like to bring up two areas if possible. One, really affecting our school children throughout the township is mental health awareness. I think going through this pandemic has really put a stress on our children, and I don't know what's being done at the school board level with regard to mental health awareness for our children. So I think a program, something of those sorts, might be helpful. Another area, I'll put my dentist hat on for a second, is oral health awareness. As we as dentists and as an oral surgeon see patients coming in after not seeing their dentist for a year and a half, 2 years, rampant decay, periodontal disease. So maybe some education on how to care for yourself from an oral standpoint during a pandemic when you're afraid to go to your dentist. So those are just two areas that I was thinking of bringing up to the group.
I think they're both great ideas. Being the child of a father of the greatest generation who served in the Army when everybody served in the Army, and Joan can testify to this, the problem with bringing up the new ideas is, of course, that you have volunteered when everybody else steps backwards. So I would make a suggestion. I might suggest that if you and Julie might, between now and the next meeting, put your heads together and suggest, well, what is it what are we going to try and do, and how are we going to try and do it on the mental health thing? I think that would be great. On the oral health, you're the pro. So not to put you on the spot, but maybe for the next
David,
meeting, we'll put you,
David, maybe a presentation from Bob, like we used to do, where they, every member would try to give a presentation of something they were concerned or passionate with. Maybe it's just a short 15-minute presentation, because it is taped and it is put on the website. At least start there. That's easy. I would suspect for Bob to do.
so to paraphrase it, that you could actually provide, if you were to give us a 15 minutes, sounds like a great slot at our next meeting, on oral health and the role at the level that we operate, that could turn into the project in and of itself, or could be the drive for a broader project in terms of, as Kathy says, that will get onto the website, it will be archived, and you can spread that word around by going to the board members and just asking them to raise the awareness in the letters that they send out to their constituents. So if you're agreeable to that, we'll expect to hear from you next month. Excellent. Great. Anything else under that topic?
Yeah, oh, sorry. I can't see you to know if I should talk or not. I think that the mental health awareness would be great. I think even to start with a list of resources that, can be easily distributed to parents, teachers, et cetera. Like, where do you go for help? Starting there would be great. And then also, signs to look for in children and adolescents if they're in distress.
So I think that's a good idea. Actually, Kathy, you would be better than I at remembering, but I thought that we did have a suicide prevention expert in, it's about 2 years ago now, and that included a now archived list of resources for those individuals. So can I suggest that between now and the next meeting, I don't know, Kathy, if you could direct them to it, or we get you directed to that resource and use that as a starting point for where we might not just drop it off there, but continue to move this forward. So do you want to?
Yeah,
take
let me see what I have, and then I'll give Julie the link or what we discussed and take a look at it. I can't remember if it was for children particularly or adults. I can't remember.
I think it was for a school age.
School age,
people
okay.
predominantly, yeah. So for purposes of follow-up, Julie, can we call on you to take the lead on that? And we'll ask Bob to take the lead on the oral health issue for the purpose of the follow-up.
Can I also just add, in terms of a list of resources, Julie, that both the township and the school district do have websites, and I don't know if you want to take a look at those and see if you can identify a place on those websites where a list of resources like that would sort of be a good place to live for the public to access them.
Yeah, sure.
And that's a really good point, because as with the animal ordinances, when you go and look, you might say, oh my goodness, this needs an updating. Just
Right.
in case that might happen. All righty, so our last, am I okay to move on? Anybody else want to weigh in? So the last item on the agenda is public participation. We do have a member of the public who we serve in the audience who would like to bring some issues up.
Sarah Pilling, 29 Garrett Avenue. David, the blood drive was held at the Sulpizio Gym, not at the Township.
I think, could you correct the?
I will. Got it.
Okay.
Could
What
you
I
just
wanted
capture
to-
that, so we'll correct the health officer's
Yep.
report. Thank you.
What I wanted to speak about, I'm a climate change person, a very frustrated climate change person. And since about 2010, every summer has been hotter than the summer before. This last summer we had, because I'm a geek, we had 21 days in July that was over 90 degrees. And the issue that is more important, as important as the 90 degrees, is that there were many nights when it was 90 degrees at 11 o'clock at night. So it's not cooling off. 3 or 4 years ago, COVID has sort of screwed up the time schedule. We had this issue, and I brought it to Bob Zinkowski, who is the township manager. And the fact that there are 13% of the township are seniors over 65, and over 6%, not 7%, 6% of the residents of this township are in the legal definition of impoverished. So I was concerned about people who either don't have fans, don't have air conditioners, don't have electric bills that can tolerate air conditioners, and that they are very vulnerable as to heat. I speak from personal experience. This last summer was awful. So several years ago, I spoke to Bob Zinkowski about it, and Bob opened this building as a cooling center, talked to the senior center, and they opened to his cooling center, as did the library, which would have been a little bit more difficult this summer. And also, I have no idea where the money came from, but Bob was able to get a group of several fans, and he gave them to the police, who know where such people live, and they distributed fans. Move forward to this summer, in July, and I knew I was suffering, and I can't imagine. I have neighbors who don't have the financial resources, or their houses are not applicable for air conditioning, which is the issue in my house. It's just too damn old. And I didn't have $30,000 to put air conditioning in. So I called the township again, and I got nowhere. I was told that this room was being rented to a group from outside of Radnor Township, and there was COVID. And furthermore, how would they possibly find out the people who were having problems? To which I replied, news alerts, newspaper, and 7 commissioners who should know what was going on, and nothing happened. So I'm bringing it to you because I'm in firm belief that the summer of 2022 is not going to be cool. There's only one way the temperature is going up. And I'm very concerned about seniors primarily. Heat is also very bad for babies and anyone who has asthma, COPD, or heart disease. I know seniors now who've never had air conditioning who are saying, you know, we're going to have to spend the money to do this. I don't think climate change, sea level rise isn't going to hurt us. It may hurt your summer home, but heat is what's going to get us. And I would like the Board of Health of Radnor Township to begin to talk about this. Yes, it's getting cold, but if we wait till March to start this discussion, in the summer of 2021, the first day of over 90 degrees was May the 5th, and we had days over 90 degrees into September. Sort of anecdotal to that, we have 2 very elegant playgrounds with pretty elegant play equipment, and that play equipment could not be used from the end of April till September because it's metal and they're not in the shade, and it was too hot for the little kids to go on it. Now, Jim Higgins brought to the Board of Commissioners the fact that some sort of a canopy, and if you went to the Philadelphia Flower Show this year, which was at FDR Park, you could see the remedies, but the township is going to allocate $140,000 to put up something so that those playgrounds are not in the sun, that they've got some sort of shade. So it's an issue I think we really need to begin to take seriously, and I hope that the Board of Health will have some kind of discussion and perhaps create some plans that if we have another extended heat wave, all the plans are made, it's just turn the switch and it go to go. Thank you very much.
Thank you. And Kathy, for the purposes of the minutes, I'll take that on as my accountability.
Okay, thank you.
So with that, if there's no other public participation, no other issues to be raised, may I have a motion to adjourn?
A motion to adjourn.
Second?
Second.
The meeting is adjourned.
Thanks all.